Welcome to the Creative Commons RX podcast. Before diving into this episode, I want to ensure we're all on the same page. This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.
All right, today we are diving into a type of poisoning that is, well, it's bizarre. And what's wild is that it can be caused by things you probably have in your medicine cabinet right now. The symptoms are just so strange, they sound like they're straight out of a fever dream. So let me ask you this. What in the world could link a common allergy pill like Benadryl, a toxic plant, and some prescription antidepressants? It's a weird combo, right? Well, it turns out they can all trigger the exact same strange and really dangerous reaction in the body. It's a true medical mystery.
And when I say strange, I am not kidding. You know, to remember all the signs, clinicians have this very vivid old-school rhyme. Mad as a hatter, blind as a bat, red as a beet, hot as a hare, and dry as a bone. And that translates to real symptoms: delirium, huge pupils, flushed skin, a high fever, and being so dry you can't even sweat.
Now, you're probably thinking, okay, this sounds incredibly rare, like some exotic thing I'll never see. But you'd be wrong. This cluster of symptoms, what we call a toxidrome, actually accounts for a staggering 15 to 20% of all acute poisoning cases that show up with delirium. So yeah, this is a very real and surprisingly common problem.
So who are the bad guys here? Let's pull back the curtain and unmask the agents behind this whole strange syndrome.
So the offenders are all what we call anticholinergic agents. I know it's a bit of a mouthful, but the idea is actually pretty simple. Imagine your nervous system has all these important locks, and the right key is a neurotransmitter called acetylcholine. Well, these agents are like the wrong key. They get in the lock, they jam it, and they stop the body's normal signals from getting through.
And the list of suspects is actually pretty long. You've got prescription meds for things like bladder spasms or even Parkinson's disease. And it even shows up in nature, in plants like the infamous Jimson weed, which is just packed with these compounds. But the most common culprits? They're hiding in plain sight. We're talking about simple, over-the-counter antihistamines, and the number one offender is diphenhydramine, the active ingredient in Benadryl. That's right, one of the most common medications found in homes all across the country.
Okay, so now that we know what causes it, let's investigate the crime scene itself, the human body, and see how this poisoning actually causes so much chaos.
So remember that key in the lock analogy? This is where it really happens. These agents jam up very specific locks in the body called muscarinic receptors, and that blockade is what causes that whole classic mad as a hatter, blind as a bat presentation. The delirium, the flushed skin, all of it. But here's the plot twist. As dramatic and frankly terrifying as those symptoms are, that's not actually the part that's most likely to be life-threatening.
Here's the hidden killer. The real danger often comes from a totally different side effect. A lot of these drugs, especially things like tricyclic antidepressants and even big doses of antihistamines, also block something called sodium channels in the heart. You can think of it like short-circuiting the heart's electrical wiring, and that can lead to fatal arrhythmias.
Okay, so a patient shows up looking like this. How do clinicians fix it? Let's dive into how they crack the case and treat this tricky poisoning.
This is where some real detective work comes in. You see a patient who is agitated and has a fever. It could be a couple of things. But there is one giant clue that separates this from something that looks similar, like a stimulant overdose. It's the skin. A patient with a stimulant overdose will be sweating buckets. An anticholinergic patient, they're bone dry. And that's why one of the very first things you have to do is get an EKG to check the heart's electrical activity. Remember that hidden killer, the short-circuiting? An EKG is how you spot it. You're looking for a specific warning sign, a dangerously wide signal called a QRS complex. If you see that, the entire game plan for treatment changes.
So treatment always starts with the basics, what we call supportive care. That means making sure the airway is safe, actively cooling the patient down, and usually putting in a catheter because they often can't pee. That's the full as a flask part of the saying.
Now, when it comes to the specific medications, it's kind of a showdown between two main options. In one corner, you've got benzodiazepines, which are your standard sedatives. In the other corner, you have a specific antidote called physiostigmine. But each one has some serious pros and cons you have to know about.
Let's start with benzos. They are absolutely the right choice for one thing, seizures. But for the delirium, they're pretty much useless. In fact, if you just keep giving more and more to try and calm the patient down, you can start a vicious cycle that actually makes the delirium worse and makes it more likely they'll need a breathing tube.
The real hero for fixing that mad as a hatter symptom is the antidote, physiostigmine. It works by basically flooding the system with more acetylcholine so it can overpower the poison that's jamming up the receptors. And wow, is it effective? We're talking about reversing delirium in up to 87% of cases. It can be like flipping a switch.
But, and this is a huge but, this hero has a critical weakness. Remember that dangerous heart problem we look for on the EKG? If you see any sign of that sodium channel blockade, physiostigmine is absolutely off the table. Giving it in that situation could be life-threatening. This is why that first EKG is completely non-negotiable.
So, let's wrap this all up with the final verdict. What are the key survival signals you absolutely have to take away from all this?
Okay, here are the big three. First, you have to recognize the toxidrome. Know that mad as a hatter, blind as a bat rhyme. Second, remember that dry skin is your #1 clue that sets it apart. And third, and this is the most critical point, an EKG is absolutely essential to check for that hidden heart danger before you even think about giving the antidote, physiostigmine.
So we've seen how some really common everyday medicines can cause this completely bizarre and dangerous poisoning. These drugs are in millions of homes. So the final question I'll leave you with is this. Now that you know, do you think you could spot the signs?
This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.